Thank you, Speaker. My question is to the Premier. After years of planning, this month, the University Health Network, as well as the City of Toronto, the federal government, in partnership with Fred Vector, converted a parking lot into a 51-unit supportive housing project. They are now housing unhoused patients who have been ending up in our emergency rooms. But this project had to go ahead, Speaker, without the support of the provincial government because they have waited too long. There is a solution on the table to build supportive housing. It will reduce ER visits. It will end chronic homelessness. Why is the government failing at the most basic step of this process and not at the table with them? Why is this province not committed to long-term funding so that they can build more supportive housing to end chronic homelessness?
To reply, the Minister of Municipal Affairs and Housing.
Appreciate the opportunity to answer the question. The member, of course, will know that we are supporting homelessness. The homelessness prevention program is at its highest level in provincial history. In addition to that, Mr. Speaker, we have committed well over another $600 million to both the City of Toronto and Ottawa for the homelessness prevention programs in both those cities. Ostensibly, Mr. Speaker, we truly understand how important it is. That's why we're working very closely with Ontario big city mayors. That's why we're working with Order to ensure that the maximum amount of resources are put in place to help us address this problem province-wide, Mr. Speaker. Thank you.
Supplementary question, back to the member for Toronto Centre.
Thank you, Speaker. I did not hear an answer in the minister's response. Getting people off the streets who are sleeping rough, people who are setting up in tents in parks, is a very good investment. It is much cheaper to house people than to confine them to an expensive hospital bed. Supportive housing is needed to end chronic homelessness. We know that it requires 24-hour support, nursing care, a virtual link to emergency health services on site. This kind of care is not radical, Speaker. It's actually critical and proven to work. People on the wait list for supportive housing are literally passing away and dying while they are on this wait list. They are waiting for this government to step up. Ontarians are dying. Cities are broke. They need this government to be a partner. My question once again is, when can the University Health Network, the City of Toronto, the federal government, Fred Vector, expect a long-term funding commitment from this government for one of the most innovative supportive housing projects that we have seen in Ontario?
Members will take their seats. And the Minister of Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. As I said, look, we've provided significant additional resources, not only to the City of Toronto, of course, to the City of Ottawa and across the entire province, Mr. Speaker. We increased the budget for our homelessness prevention programs under the previous Minister of Municipal Affairs and Housing by over $200 million, bringing that level of support to the highest level in provincial history, Mr. Speaker. When it comes to our supposed partners at the federal level, Mr. Speaker, this is a federal government that was supposed to sign a deal with us on Thursday and decided to walk away from the table, ostensibly because they didn't want to fund homelessness programs in some of our other cities. London, Oshawa, Windsor, Mr. Speaker. These are cities that the federal government did not want to fund. We said that that was unacceptable, that we would stand up for all Ontario cities that are dealing with homelessness, Mr. Speaker, and that is why we're providing the level of funding that we are, the highest.